The plenary session yesterday was absolutely fantastic. So go to the presidential plenary session. It's much relevant to clinician scientists, but mostly to clinicians who really need to know some of the rapidly evolving landscape. So take a look at the presidential session. I would say that in the world of neuro-oncology, apart from what I've mentioned previously about knowing the indications for and complications of immunotherapy, look very carefully at numerous abstracts that have to do with IDH mutated tumors. So there has been, as everybody knows, about a 2.5-year period when vorasidenib has been available and has really changed the landscape. Now there are emerging real-world applications and real-world outcomes in managing these people with IDH mutated gliomas. So I think this is kind of the second generation after the original clinical trials, and see how it's really playing out in clinical practice. How do we implement the guidelines in the real world of clinical practice? I think I've been at over 40 AAN meetings, and so I'm pretty much unable to be surprised by much of anything. What I think is amazing is what I've seen over a practicing lifetime is a marked increase in diversity of the neurology workforce, the growing international workforce, the application of many of the American Academy of Neurology's guidelines to people taking care of patients all over the world. That's not a surprise. It's just a validation that the work of this academy has been truly meaningful over a very long period of time, and I look forward to what's coming. I think the education component, particularly directed by some of the younger education-minded physicians at various institutions, has really grown. The education room has been a place where students can go and learn about careers in neurology. They can learn about projects, interinstitutional sometimes, in which they can become involved. And I think that is a very exciting development over the last couple of years, and I hope that continues.